This webinar is brought to you kindly by SafMed. SafMed has been your solutions partner for the last 30 years, both in the CSSD environment and the operating room theatre environment. This is the fourth webinar in our Sterility Assurance webinar series. In the last 4 events, we've learned to understand what sterility assurance is all about. We've learned about the role of sterility assurance in the prevention of surgical site infections. And now in webinars 3 and 4, we're covering all the items that we need to be able to monitor our sterilization processes. If we summarize the pertinent points from webinar 3, I think the 4 things that we can focus on or realize that perhaps we learned in webinar 3 were the fact that the presence of air and other non-condensable gases inside the steam sterilization chamber will hamper the sterilization process. We learned that the bioedict test was developed in 1963 to detect the presence of air and non-condensable gases. We also learned that using a helix process challenge device with a type 2 chemical indicator in each load will improve the likelihood of CSSD providing sterilized instruments and devices that are safe to use on a patient. Remembering, of course, that the helix will test whether steam was removed, whether air was removed and steam was able to penetrate into porous loads, as well as down the lumens of Yankow suctions or laparoscopic instruments, for example. We also learned that to ensure best practice, we need to be able to track, trace, and recall packs in the event of sterilization failures. In this published paper, published in the American Journal of Infection Control in 2016, Rose Seavey, who's well published both in the AORN journal as well as in the American Journal of Infection Control, reminds of a few important things. So this paper was actually really about troubleshooting failed sterilization loads, process failures and wet packs, and that could be something that could create a whole new series of webinars around process failures, wet packs, and difficult loads or load failures. Rose reminds us that sterilization failures may place our patients at risk, and are quite likely to, I should think. She also reminds us that it's really important that managers, CSSD technicians, unit managers, theatre managers, and our IPCs should really know what to do in the event of a chemical indicator or biological indicator failure. Again, something that we could run a whole series on. Sterilization failures can occur for a number of reasons, and of course it includes user error, and that can be quite a difficult thing to manage, a malfunctioning sterilizer, and of course steam quality issues. So we know we have to monitor sterilization, and to do that we check the physical monitors, which means that we check the gauges and the printouts to verify that our equipment is actually working correctly and achieve the sterilization parameters that it was supposed to achieve. We then, of course, use chemical indicators to verify that one or more of the conditions necessary for sterilization have been achieved at a specific location within the load. We use biological indicators to verify that the conditions at a location within the load were indeed adequate to kill a population or a known population of microorganisms that are resistant to steam sterilization or the sterilization process at hand. And that, of course, demonstrates the lethality of the sterilization process, how lethal it is, how able it is to kill microorganisms. In webinar 3, we spoke about using bioedict tests, we spoke about using documentation systems, and we spoke about helix devices or process challenge devices and how they help us in monitoring steam sterilization. Today, we're going to focus on external chemical indicators, internal or in-pack chemical indicators, and biological indicators. External chemical indicators are visible on the outside of the pack. like, for example, an autoclave tape, which we personally would apply to a particular type of a pack. Chemical indicators are also often found on plastic paper peel pouches. They are already preformed or impregnated into the packaging material. They, of course, can only tell us which packs have been through a sterilization process and which packs haven't been through a sterilization process. In my early years of nursing, I always thought that it actually meant that the pack was sterile. But thankfully, I learned a lot more since then. They really and truly only tell us which pack has been through a sterilization process and which hasn't. Internal or in pack chemical indicators are placed within a load, within a set, or within a pack. And of course, if we're putting them inside containers of different levels, we would probably want to look at putting one on each level. In this regard, we'll talk about type 4, type 5, and type 6 chemical indicators. And then, of course, biological indicators. And biological indicators contain spores like Bacillus erythematophilus or Bacillus subtilis, depending on what type of process or sterilization sterilant we're trying to test. And we're going to go into a little bit more detail around that now. All chemical indicators need to be manufactured in accordance with a specific standard. The standard number is 11140. In 2018, SANS adopted 11140 directly out of the ISO standard, so it has not been changed, it's not been adopted. It's exactly the same standard as the international standard that exists in South Africa. So if you're using a chemical indicator in the South African setting, that chemical indicator has to be manufactured within the preview of this standard. You cannot use one that is not manufactured according to the standard. In this particular standard, it goes on to categorize the different types of chemical indicators. And as you can see them listed over here, this is actually a copy and paste, a little extract from the standard itself, which is easily available and can be purchased on the SABS website. Type 1 processes are defined as process indicators, which we now know. Those, of course, are the external chemical indicators we've already spoken about. Type 2 are specific test type indicators, an example of which is the Bioedict test pack. Type 3, 4, 5, and 6 are all internal chemical indicators. There are two main types of chemical indicators. One is based on more of a physical change, and the other one is more on a chemical reaction. In the physical changing indicator, a chemical pellet melts when exposed to the sterilant for the right amount of time at the right temperature. The pellet changes from a solid to a liquid, and that liquid then wicks along the paper. It's often called a moving indicator or a moving line indicator. In the other type of indicator, the one on the right, chemicals in the ink will change color when exposed to the sterilant for the correct amount of time at the right temperature. And that's the main difference between those two types of chemical indicators. Let's go on to discuss a little bit more about the differences and the nuances between the different types, type 4, type 5, and type 6. Type 3 chemical indicators are seldom used in the South African setting, in fact, seldom used internationally as well in healthcare settings anymore. So we'll focus then on type 4, type 5, and type 6. Type 4 are often referred to as multivariable indicators. That's the correct term in the standard. And the standard says that a type 4 chemical indicator must react to at least 2 or more critical parameters. Of course, the critical parameters being that of exposure to a sterilant for the right amount of time at the right temperature. Some manufacturers, of course, will make chemical indicators that do react to all 3 critical parameters, and that's probably something you'd like to look for if you're using a type 4 chemical indicator. Type 5 chemical indicators are referred to as integrating chemical indicators, and they react to all the critical parameters, all three. Type 6 chemical indicators are also known as emulating or cycle-specific chemical indicators, and they also have to react to all three critical parameters as stated in the standards. When a manufacturer now releases a product and the manufacturer says, here's my chemical indicator, they have to say what the stated value is. So they need to say, for example, that this particular type 4 chemical indicator is designed to be used in an autoclave cycle of 134 degrees for, say, 3.5 minutes. They specify that. The ISO standard says that if the manufacturer is making a chemical indicator like this, now we're referring to a type 4, the manufacturer has to make sure that that chemical indicator doesn't change color or doesn't give you a positive result or a pass result too soon. It has to do the job that it's expected to do. But the type 4 is allowed at 25%, a minus 25% variance, which means that that chemical indicator could actually start changing color around 2 minutes and 37 seconds into the sterilization time. With the type 5 chemical indicator, the standard allows for a 15% variance, a minus 15% variance, which then means the type 5 chemical indicator could change color as soon as 2 minutes and 59 seconds into a 3.5 minute sterilization time. For a type 6, that tolerance of variance is a lot less, making it a hell of a lot more accurate. It only allows for the standard, says the manufacturer, when they're making this product, may have only a 6% variance, which of course would mean in this example, it would only be able to change color no sooner than 3 minutes and 18 seconds. And hopefully that does explain the difference between the various types of chemical indicators and why type 6 are referred to as the most accurate chemical indicator possible. Type 5 chemical indicators are designed to have a performance that is similar to that of a biological indicator. Type 6 chemical indicators, as we said before, are cycle specific. So they're designed to meet the actual sterilization cycle that's being conducted. I'll explain that in a bit more detail. As you know, as you can remember, that the steam sterilization cycle will begin with the removal of air, as depicted over here in our diagram. We remove air, we inject steam, we remove air, we inject steam, otherwise known as pulses. The process is repeated during these pulses until such time as we get to 134 degrees C. When we get to 134 degrees C, known as our sterilization plateau, the steam sterilizer will then sterilize for the amount of time that we have set it for, and that could be of course, it's going to be at 134 degrees. That could be for 3 minutes, 3.5 minutes, 4 minutes, 5.3 minutes, or in the event of a prime cycle, I think it's 17 minutes, if I remember correctly. We can then use a type 6 chemical indicator that is designed for that specific sterilization time. It's really important that we know and understand what the sterilization time is, the required sterilization time is for all the devices that we process, that we put into our steam sterilizers. If you look at the instructions for use on the right over here, this is for a System 6 battery pack, for a Striker System 6 battery pack, it clearly states in the manufacturer's instructions for use that these devices must be sterilized between 132 and 134 degrees, wrapped or unwrapped, with a 4-minute exposure time. So I really wonder if you've ever really studied any of your manufacturer's instructions for use to ascertain what your steam sterilization time is meant to be. Because if you haven't done that, in fact, you're not following the instructions and you may not necessarily be getting a sterile device at the end of the day. So the only way to know it is firstly to understand what the instructions for use are for all of the instruments that you sterilize, all of the devices that you sterilize, as well as importantly to know what the sterilization time is on your autoclaves in your CSSDs, because they're not necessarily all the same. I remember at one point, if I remember correctly, the Netcare group had decided that they would standardize their sterilization time at 4 minutes across the group to make sure to cover all of these angles and try and make sure that they got the correct sterilization parameters. Please go back, look, ask for the instructions for use. Try get them for your loan sets because they are quite clear and they are quite specific. If you're not doing that, you're not necessarily getting the sterilization time that is required for the devices that you're sterilizing. Moving on to chat about biological indicators. In the early days, biological indicators were simply spore strips. There weren't any vials. It was a spore strip that was placed inside the steam sterilizer. After the sterilization process, the spore strip was then put into a vial and incubated. Of course, the self-contained biological indicators that we know today were introduced in the 1970s, and there are three main types. The traditional biological indicator, that needs to be incubated for a period of 24 to 48 hours, depending on the make and the model of the product. The rapid biological indicator, that'll give you a readout in about 4 to 8 hours. And the ultra rapid, which will give you a readout in less than an hour. Some, of course, are down to just over 20 minutes. Self-contained biological indicators, as you know, contain spores on a paper carrier that's represented with the pink dots in our schematic on the left. They are then placed in a vial in an ampule with an ampule of media, which is the blue in the schematic over there. The test biological indicator, the test, is placed in the autoclave in a full load, is sterilized, removed from the autoclave, the vial is sealed, the glass ampule is crushed to release the media, which is the food. We want to see whether the spores will or will not grow. This, of course, is then incubated. The control BR, remember, is not sterilized, it's sealed, it's crushed, it's incubated. The spores in the control test mix with the growth media and the spores will grow. They should grow. And eventually this results in a color change that's visible to the naked eye. Hopefully all the spores in the test biological indicator were inactivated during the sterilization cycle and therefore should not change color. If it does change color, then of course we have a failed BI. We spoke about incubation, and what we want to talk about now is the biological indicators detection methods. In the past, we used this one over here. So in that regard, what happened was there was spore activation and germination, which we want. We want the spore to grow. And then it's a complex multi-step process, and there are a whole bunch of biomechanical reactions. And at the end of the day, after 24 hours, there is that color change in the vial that's visible, and we can see it with the human eye. In rapid biological indicators, when the spores start to activate, they release an enzyme. And that enzyme reacts with the special indicator in the growth medium that produces a fluorescence or a light, which the incubators are able to detect. So it's a slightly different methodology, and that's why the incubators tend to be so specific, both to the product and different to the incubators that we used in the olden days. In the older days, it was less complex. It was really mostly there to warm up the spores and the growth media together. Now it's required to read light and to measure. So it's very different. It's a more complex design, the incubator, and tends to cost a little more than the other ones used to. As you'll remember in webinar 1, we spoke about the fact that it takes approximately 1 minute at 134 degrees to inactivate 10 to the power of 6 or 1 million microorganisms. So this actually means that a biological indicator would give you a pass in about 1 minute, whereas a type 6 chemical indicator measures the entire exposure time, the entire duration of that sterilization plateau, assuming, of course, you've chosen the correct chemical indicator for your specific autoclave's sterilization time, whether it's 3.5 minutes or 4 minutes, for example. And that shows you a little bit of a difference between what happens in the steam sterilizer between a biological indicator and a type 6 chemical indicator. Now remember, a type 5 chemical indicator is designed to react the same way as a biological indicator. So we use biological indicators and type 6 chemical indicators in the South African setting quite a lot. They both have a role to play in our sterilization monitoring processes. The biological indicator won't monitor the entire cycle. It must be incubated, but it's an actual microorganism. A type 6 chemical indicator will confirm the conditions within the load, will assess the steam penetration for the entire duration of the cycle, but it's not a quantitative amount. So both have a role to play. All of the consumables we've now spoken about over the last 2 webinars are all part of the process of monitoring our sterilization processes. Everything plays a role. It all comes together. If you summarize this in essence in this webinar 4, what we've learned is that external chemical indicators are visible on the outside of the pack. They verify which pack has been processed and which pack hasn't been. Type 4, Type 5, and Type 6 chemical indicators are used inside our packs. Type 6s, of course, are going to give us good accuracy. The biological indicators will demonstrate the lethality of the sterilization process. And of course, we can use traditional rapid or ultra-rapid biological indicators as part of our sterilization monitoring process. In conclusion, if a device is not properly cleaned, of course, or properly sterilized, it can and will transmit microorganisms. CSSD plays a critical role in the prevention of surgical site infections. It is our responsibility, we read that, we heard that from the World Health Organization, to ensure that every medical device that leaves our unit is completely safe to be used on a human. And that is why sterility assurance is so important. But please remember that monitoring sterilization is just one part of the process, one part of sterility insurance.